Hi. Let's see. Okay, I sent you an invite, or is it? Okay, you sent me a request. Oh, there we are.
Hi.
Hi. Oh my gosh, I've been telling people like I'm gonna be fangirling this whole time. I'm so excited to meet you.
Stop it. Nice to meet you also.
Yeah,
Hello,
thank you so
hello.
much. Thank you so much for agreeing to chat with me and
Yeah,
talk about this very what can be a touchy subject for a lot of people.
absolutely.
Thing that comes up a lot in my practice. I really wanted to bring in an expert in the physical body and muscles and everything to help explain what some of the misconceptions are about living in a larger body in pain, especially as a smaller bodied person. That's something I
Mhm.
always like to address is that privilege that I have with clients, and that
Mhm.
it can be more challenging for, I think, people to hear it from me. I mean, especially as a dietitian, that pain doesn't necessarily come from living in a larger body. So yeah, I'm really excited to hear from you. Oh, did it freeze? No, we're frozen, I think. Oh, let me see if I take my. Oh no, my husband just joined. Babe, am I frozen? Because it's showing. Let me take my laptop off the Wi-Fi just in case. Oh, I might have to restart this. Are we all frozen? Okay, let's see. Okay. Rodney says he hears. Okay, so let's see. Okay, there we are.
Okay.
Okay.
All right, got it.
Hopefully, yeah. Sorry, y'all, for the technical difficulty. Hopefully, technology doesn't always want to be our friend. So,
Usually
hopefully,
doesn't.
hopefully it'll be smooth for the rest of this. But, um, yeah. So I was just saying, a lot of so many misconceptions about living in a larger body and pain and a lot of shame that comes with that too. I actually just realized that you had this conversation with another dietitian on a podcast, because I
Mhm.
was doing some googling and it came up and I was like, oh my gosh. So yeah, I would
Yeah.
love to hear from you just like what are I'm sure you are probably much more concise than I am when it comes to this topic. So yeah.
No, I mean, I talk about it regularly. Yeah, it is a very good a point of contention for a lot of people. And I do think it's a great opportunity. I have so many dietitians in my Rolodex of people that I love to connect with, because it's a great place to sort of bridge a gap in helping a community of people who don't quite understand, and not, I wouldn't even go as far as to say ignorance. I mean, it's ignorance when you don't know something, but what's being reinforced in the medical world, in the fitness world, is the very opposite thing to what my message is. So most people don't quite get this and don't understand it. And so I love to talk about it and spread the word and kind of share my perspective as I consider myself like a movement expert, in the sense of like understanding how our bodies, function and move, and having a decent sense of the anatomy, the biomechanics of things. And I think, even in my training as a physical therapist, I was essentially taught that increased body weight means your body is less healthy, and means you're going to have more pressure on your joints and more pain. And there's an element to that that can be true in instances for specific people at specific times. But in general, that's not exactly how our bodies acclimate. When someone says like, oh man, if I could just lose 50, my doctor told me to lose 50 pounds and my knee pain will probably go away. And I'm like, I don't, I'm not going to say that, because I've had clients, I've had people on the internet debate me. I've had people say, well, when I lost weight, my joint pain did go away. I cannot, deny someone's experience. That may have been what happened for you. I challenge people to consider, are you sure that it was the weight loss? Are you sure it wasn't some of the activities you engaged in that helped to manage the pain? And that's sort of the area I like to help people sort of deconstruct this idea that weight loss equals this. You may see that because you're more active and you're stretching, maybe you're taking joint supplements and drinking more water and getting better sleep, that all of a sudden your joints feel better. And as a result, maybe you've lost a little weight in the process. But to be very clear, many of us, most of us, I would say, can engage in those health promoting behaviors and our body weight never change, and we can still get the benefits of improved joint health and less pain. So I just like to challenge people to consider an option that you hadn't before, especially because, you know, what we both know about intentional weight loss in our day and age is that it's unsustainable for 99% of people who attempt it, and that a lot of times people who are able to sustain weight loss are engaging in extremely unhealthy behaviors. There's a lot of malnutrition around, you know, people's efforts at getting smaller, and that actually does not serve the joints. And maybe temporarily you feel better because you have more freedom of movement in some ways, but you are starving your bones of the nutrients and your muscles of the nutrients that they need. And long term, that is going to be far more problematic for your quality of life than just existing in a heavy body. So, yeah, something I talk about all the time, but I'm never shy to talk about it again, because I do want people to know, you know, if body weight or weight in general damaged our joints so significantly, then we would never tell people to lift
Mm-hmm.
weights.
Mm-hmm. That's
You know,
what
let's
that's one thing that I try to, you know, bring up, that like contrast with people. Like, why do we tell people this then? The weight bearing exercise is so good for our
Mhm.
bones and our joints, you know, like in
Yeah.
moderation. Yeah.
So weight bearing in the sense of, you know, bearing weight, pushing weight through your extremities, arms, feet, um, one way, and then progressively increasing load by adding on additional weights. Those are very healthy behaviors for movement, for fitness, because what happens when we progressively add more load is our bones, first of all, our muscles get stronger, and our bones essentially build, like they get more dense, more strong. They're acclimating to that progressive load. So, unless a person went to bed at 200 pounds and woke up at 300 pounds or 250 pounds, most of us gain weight progressively over time, and our bones are adjusting to that load in the same way we adjust to the load of progressively adding more weight and, you know, pounds to our deadlifts or our squats or our lunges or whatever.
Mm-hmm.
So you don't just have bone damage simply because your weight is increasing. And that's what I just need people to understand. Now, is there a correlation between sometimes our increased weight and our increased, you know, sedentary lifestyle? Absolutely. Maybe you're in grad school and you are typing away every day and sitting in class, and so your body's gotten bigger and now you feel a little more stiff and a little bit less mobile, but there are other factors. It's not, oh, my joint pain happened because I've gained weight. It's other things. So in my line of work, what I try to do, I'm a physical therapist and I practice from a weight and size inclusive perspective, trauma informed, eating disorder informed, and then I am a body image, health, and movement coach. So on both sides of the screen, I am trying to help people accept and acknowledge what their body is and where it is, make peace with that, and then engage in health promoting behaviors that are going to help them feel better, whether their body changes as a result of that or not. And taking the emphasis off of the body changing and putting it on the body feeling better, feeling more mobile, feeling more flexible, feeling stronger, being able to do some of the things that either you previously could do or you've never been able to do, but just embracing that journey and wherever it takes you, no shame, everything is neutral, but not focusing in on like, I have to be this size or I have to lose X amount of pounds, because those, you know, what we found in the research, weight centric healthcare, weight centric fitness, it doesn't typically lend or lead us to improved health over time. It just doesn't. And when we take weight and body size out of the equation and we just focus in on the feeling, the connecting with the body, you know, the joy, all of that, people's health, you know, increases exponentially. So that is where I try to lean with all of my clients, whether it's recovering from an injury or feeling better about their bodies. It's really just about letting go of this idea that your weight really matters, because it really
Mhm.
doesn't. So,
Yeah, I
yeah.
love that. I mean, it's so important. I mean, especially, like you mentioned, the shame that people might feel and just coming to peace with where we're at right now and like, what can I do in this moment to help my body feel better? And
Mm-hmm.
I've been open about my own eating disorder recovery journey, like through my
Mm-hmm.
practice. And, the movement piece took me a very long time. And
Yeah.
that I think there's really something to be said for tapping into that feeling, when we
Mm-hmm.
can help people tap into the sensations that they're feeling in their body and how that can be so much more motivating long term,
Mm-hmm.
a number on the scale as well.
100%.
Yeah, and one of the other things I know that, like you mentioned, the earlier, going to the doctor and saying, "Hey, I have knee pain. What's something I can do about this?" And being told, "Well, you need to just lose a bunch of weight." And it's like, I think a really profound question that can be asked that I've gleaned from probably mostly like Reagan Chastain is,
Mm-hmm.
what would you recommend to someone in a smaller body with this same problem?
Yeah.
Because that you know that is ultimately leading to poorer quality health outcomes because of that poorer quality healthcare due to that weight stigma, right? So I'm sure that's
100%.
something that you've experienced, with your clients as well.
Oh yeah, yeah. And that is the magic question. What treatment modalities or treatment options would you offer to someone in a smaller body with my same complaints? Because the reality is which is why, obesity being considered a medical diagnosis is just so dumb, because there's no qualifiers like there's nothing that is unique only to people in large bodies that does not happen to people in small bodies. We're talking about heart issues, lung issues, like, you know, everything. There's diabetes, like everything happens to people across the board.
Mhm.
So being in a large body is not a disease and diagnosis in and of itself, even though we treat it as though it is. So that's the magic question. What would you offer to someone in a smaller body with my same complaints? Because I'm sure you've seen other people in smaller bodies with my same complaints, and getting that information. But really, I like my clients to recognize that, not everyone is going to be like super sassy and willing to call out medical professionals. I am, and I encourage other people to, but it, the reality is, what if your healthcare professional, if you tell your healthcare professional, I have a problem, for example, my knees are really hurting, it's been very bad, and that medical professional, whether they do any diagnostics on you or not, most of the time it's a no, and their response is just lose weight and it'll probably feel better, that is lazy medicine.
Mm.
That is neglectful medicine. That is doing harm. And that is in direct opposition to the formal and informal oaths and vows we take as healthcare professionals and physicians and whatnot. And so that is problematic.
Mhm.
Like there's something wrong with that. So if you have a medical or health or fitness professional that is making that recommendation, especially if that is the primary or the only recommendation, you probably need a new one. You probably need a new medical or health professional, because it's doing harm. Because, like I said earlier, the research is very clear on intentional weight loss. And this means for anybody starting a diet, doing a new lifestyle program, starting a program at the gym, whatever, if the aim and the goal is to lose some weight, we know only 1%, maybe 2, of people lose a significant amount of weight and keep the weight off beyond a year to the data past 3 years is like non-existent, because
Mhm.
we almost always gain the weight back. And most of us over the course of our lives, we just weight
Right.
cycle. We diet and lose weight gain over and over, which does way more harm to our bodies, especially our hearts, than just living in the bodies that we have. So as a healthcare professional, as a physician, as a doctor, to make that recommendation it's just neglectful. It's malpractice in my opinion, because it's not considering the whole person, and it's not being willing to investigate what this person actually needs and challenge your own thoughts. Just because we go to school and get all this education, I'm a very different physical therapist than I was 17 years ago, when I finished physical therapy school. I've accumulated some knowledge and some experience and lived experiences as well. And I know more than I knew then, and I know things from a different lens. And so if you're not willing to grow and learn and shift with the evolving research and time,
Mhm.
then you probably shouldn't be practicing anyway, because you can't really help people effectively if you're very stuck in this old system. If you're still relying heavily on the BMI, if everything is very weight centric and weight focused, you're not really doing, a service to your patients. So just retire. No, just find a new trade. I don't know, but yeah.
Absolutely.
So.
And I mean, even the AMA came out, I think was it 2023 or 2024? I can't remember. And said, right, that BMI is not an indicator of health. We should not be relying on this so heavily, So I think that, that there's a level of like, as you're speaking about like growth as healthcare practitioners, and I can't help but also think about like the ego that a lot of like,
Oh yeah.
older healthcare practitioners
Mm-hmm.
as a very, the field looked very, everybody kind of looked the same in the field, versus there has been a bit more diversity and a bit, the field is a bit, moving in a younger direction now perhaps. But
Mm-hmm.
I think about, how are we challenging, do we have the self-awareness to challenge, like, what are our belief systems, behind why do I think the way that I think? And like, how can I continue to seek information to gain, a wider understanding about
Yeah.
those beliefs, to challenge those beliefs? I'm always,
Sure.
I enjoy, I don't, not necessarily enjoy, but I try to seek out people that I disagree with to continue to challenge, like, well, does this ring true for me? Why or why not? Like, what evidence do I have?
Right. Oh, there we go. Okay. I can't hear you now. Hold on. Oh, there we go. Now I can. Now I can.
Okay.
Okay. I'm like, what happened? Okay.
um, yeah. How can I continue to challenge those belief systems and to be the best provider that I can be? Because
Yeah.
ultimately, like, we want to help people, right? That's why most of us get into this profession, I think, or the healthcare field.
And most of us do. I think that is the initial plan. That's the humble beginnings for most of us. I do think sometimes along the way we get very I think we can get very caught up in ego and wanting to be like the authority on something. And I think it's great to want to have like a lot of knowledge and train and teach. I mean, I love this space of like weight stigma and advocacy for people in larger bodies and, training. I mean, I love it. And I like positioning myself as someone who can teach other healthcare practitioners and medical students, to open up their minds, but also like I am learning from other people every single day, my patients, my clients, colleagues, people not in my field. Physical therapy isn't a huge field that participates in the weight discussion or the eating disorder community. Like, we're still newer to the table, but I even have several, PT colleagues that I can lean on, and then people from other professions. And, there's so much great knowledge to just be had. And I think the difficulty for some people in wrapping their mind around that is the unlearning.
Mm,
I think it can be really hard to let go. For me personally, my journey toward this anti-diet world, weight neutral world, size inclusive world, um, a part of the trauma was taking my identity from me, because my identity was so heavily rooted in being a fitness person, a person who's all about weight loss. And when you pull that from you, it's like, who am I now? What do I do?
yeah.
So I think there's a difficult path for healthcare practitioners to walk when we have to unlearn and let go of something that was a big part of our training, a big part of our identities. If we built our practices on them, some people have like weight loss. I had a weight loss program. Now, mind you, I have no nutrition education at all, but I had a fitness program with a meal plan to tell you how to lose weight. So when you do these things, and if you ever start to gain financial, get any financial gain from these things, it is really hard to then say, okay, I'm not doing this anymore because I've learned better. It's like, wait,
Mm,
what? You know what I
mm.
mean? Like you're scared. Someone asked, is there sound? I
Yeah.
hear us. Do you hear us?
There should be sound. Yeah, I can hear us too. And I know someone had just said this is
It's a
such a
great
great
conversation.
conversation.
Okay,
So
so
I
I,
think,
I
yeah,
hope you all are hearing us,
yeah.
hopefully.
Um,
um, but yeah, so it's the unlearning, the unraveling, the undoing. There's a lot of trauma with that for people. So I I get it, but I had a very eye-opening Instagram debate, argument, conversation, whatever you want to call it, with a woman. And it was so funny because I always find it funny when people like come to your page to like argue with you about your stance on
mm.
things. It's like, I didn't invite you here, but whatever. Uh, I posted a video of me setting up my space. And the caption was basically around how I want my space to be as welcoming as possible to people in large bodies. I want to make sure there's seating that's wide without armrests, and there's equipment, and there's a table that supports your body weight. And, I have a blood pressure cuff that is, wide and wraps around your arm. Like, I want you to come into my space and feel like you can get good sound medical care and that you're taken care of. And that should be the rule, like not the
Yeah.
exception. And a woman commented, she was, I think she said she was like a trauma nurse in ER. And she said, yeah, this is all really cute, until you have an obese person with gunshot wounds and you're trying to stop them from bleeding out and they're so big and you can't do this. And it was just like a whole thing. And I was just like, wow. And it was one of the times, sometimes I told you I'm a little sassy. So sometimes I just snap right back. But this was one of the times where I had to stop and I really wanted to hear it from her perspective. And so my response was a little bit more compassionate than I would normally be.
Mm.
And I was like, you know what? I'm really sorry. I am certain, I've never done the work that you do. And I am certain that it is really challenging, like, and so stressful and so traumatic to see these things. I have a dear friend who's an ER physician, and I know like that can take a lot out of you. So I'm sorry that, that you have been so impacted by this particular topic. I was like, but I do want to say this. We sign up for these roles and these jobs that are hard. And just because something is more difficult doesn't mean our patients are less worthy. Just because something is hard doesn't mean we don't do it. You could make the same argument for premature babies who are
Mm.
super duper tiny and we don't have the equipment to get to their little veins. And it is fucking hard. I'm sorry, I don't know if I can
No,
curse here, but
yeah.
it is hard. It can be hard to treat people because of their body size, small or large. It can be hard to treat people because of their cognition or their mental health issues. But guess what? We still do it.
Hmm.
And we still are supposed to do it. And we're supposed to do it with a level of excellence and a level of compassion that all of our patients are worthy of. And so, at the end of the day, yeah, it's hard. It's harder. I have to spend more money on more durable equipment. And it shouldn't be that way, but that is the system we live in, and it is what it is, but I'm going to do it. And if I don't care. I'm a small business owner. If I have to save up for a year, I literally just did. I saved up and got a brand new table. If I have to, go on Facebook Marketplace and search for things, if I have to barter services, whatever I have to do to make my space welcoming, comfortable, and an effective area to treat people in larger bodies, I'm going to do it. Period.
Yeah.
And I just think that's the attitude that we should have in these fields. And if you don't have that, then what you're doing is projecting your shame and your judgment onto people in the worst moments of their lives if you're an ER nurse.
Uh,
And nobody benefits from that. Nobody benefits from that. So it was
absolutely.
an interesting conversation, but
Absolutely. Yeah. That, and I commend you for holding that compassion for her experience. Um, yeah, I can't imagine. And I think I like to think that you are, creating a ripple effect when like that these conversations and someone who might not have considered, what it's like living in a larger body might
mhm,
then have the opportunity to consider it when they're seeing some of these more accessible pieces put in place, right? And going,
right.
oh, wow, like how can I think, how can I, maybe that is creating this small ripple effect. I like to think when
We
people,
can hope.
oh
Yeah.
yeah, absolutely. One of the things too that I think comes up for people, one of the things in terms of like the physical therapy piece that I think comes up for people sometimes, and even for me, right? Like I've had multiple forms of pain in my body. I've had knee pain from playing tennis for extended years. I have persistent low back pain right now from an injury last
Mm.
spring. And I've been told that if I were to work on my core strength, that some of my pain might subside. So I'm wondering if you can speak to, yeah, just like uh, the truth behind that, behind like the injuries often like leading to pain, and we touched on the strength piece a little bit, but
Mhm.
yeah, the yeah.
Yeah. So, yeah, I mean, whenever I'm in an ideal situation, when we're young, like kids, our bodies are very forgiving. We can slam down on the concrete, we can play hard contact sports, and you can get up and keep going, and things will heal up really quickly. But, life changes as we get older. The longer we live, it's a beautiful thing, but the longer we live, the slower things heal. The less our bodies produce of certain things that aid in our healing. And so there's just more work on the back end. And it is one of the, I would say, struggles of getting older. But I always tell people, like, our options are get older or die young. So, where do we want to go with that? Like, let's get
Mhm.
older, right? And let's do what's within our power to try to keep ourselves healthy, but recognizing that we don't have full control over that, right? Things happen, you cannot control it. They're genetic things, components we have no control over. We can only do what we can do. And spending too much time stressing about preventing things is actually worse long term for our health anyway. So doing what's within our power. But the core, I would say, is kind of the center of the universe when it comes to our
Mhm.
bodies. If we can cultivate a strong core, which I don't think we were really taught to do. I think, the the fitness industry, diet culture's focus around core strength has so much more to do with aesthetics and the way your body, your midsection looks. It's all about like, get rid of this fat. Let's do crunches. Let's do sit-ups. And, honestly, those are the things that hurt our back and neck over time anyway. So doing a bunch of crunches and sit-ups. I'm like the anti-crunch or sit-up person. Yeah, I believe in like deep core stabilization with like pelvic tilts and transverse abdominal sets, and building up to planks and rotating planks and moving planks and things of that nature. But building a stronger core definitely can help prevent a lot of the injuries we see with the back and neck. But the other piece of that is having, good posture. A lot of us work. I think we saw this a lot with COVID when people went home to work. Oh, that's when my patients had the worst issues with their back and neck and carpal tunnel and other things, because we don't always have an ergonomic setup. I'm a physical therapist and I don't have an ergonomic like setup with my chair, but I don't sit for very long hours either. So, but having a desk space that is designed to give you adequate posture. Same thing in the car when you're driving, all of that stuff. So your posture, increasing your core strength and stability, that is sort of the goal of maintaining a good, healthy spine and having less injuries. Less impact on your knees. You're going to have, if you play tennis a long time, you're probably going to have some issues with that. That's going to be more around strengthening the muscles, around that joint in particular. But, overall, if we can stay flexible, that's the other missing piece we don't ever really talk about. If we can stay very flexible, if we can continue to build strength, and if we can be mindful of our posture, ideally we'll feel a little bit better. But you might walk off your front porch and trip and still have an injury. So again, it's like, do what you can, but don't stress about what you can't,
Yeah.
because life happens. So.
Yeah. And again, those are things that anybody in any size body can do. Anybody can focus on building strength. And one of the things I'm always telling clients is like, we can, if you're not doing anything, and I'm, again, through my recovery journey, like exercise has been the piece that's taken the longest for me.
Yeah.
So this last year, I've definitely been the most active, but still not as consistent as I would like to
Mm-hmm.
be, right? But it's been really cool to be able to it's so cool to be able to listen to our bodies when we're doing those exercises. And I'm always telling my clients, hey, you don't have to go to the gym for even 20 minutes. Can we go on a short walk? If you're telling me that, you can't do a long walk, can we go on a 5-minute walk? Can we
Mm-hmm.
around the yard in a circle a couple times, and just observe the trees and such? Like if we're how can we make it so simple to meet our bodies where they're at instead of jumping to, a lot of those expectations that are placed on what exercise should look like.
Oh yeah, that's a whole nother conversation because I think I do. So one of the reasons I love that physical therapy is taking more of a seat at the table of like eating disorder recovery is because we all know that movement is good, but we also know that for people who have a history with eating disorders, disordered eating or movement behaviors, a lot of times exercise is about changing body, managing calories.
Mm-hmm.
But at some point, and during points of the recovery process, I understand there's no movement. There's like, just stop. I think that's healthy. I did that for myself as I was trying to reestablish a relationship with movement. I couldn't do anything traditional because it was also activating or triggering. It was like making me not able to listen to my body, but it was taking me outside of my body. But there comes a time where we all have to get back to movement. And I think it's important to find a healthy way to do that. And so I love that part of my job because unfortunately, there's no other physical therapists in my area that do this. Hopefully, we'll start to expand in this area, but helping people find what movement feels good to them. So I usually strip it down to nothing, and then we start with joy. I tell my clients, like, make me a list of things you like to do that just happen to require movement. Anything that makes you smile, makes you happy, gives you energy, you just enjoy the feeling. Write it down. And we'll get sports, we'll get like, oh, I really do like the gym, or there was this machine at the gym, or this class at the gym. Great. But I get things like gardening, nature walks, hiking. People have written down sex. I mean, someone said baking, and I was like, oh, that makes sense. There's a lot of up and down and needing it. So start with the joy and then branch out from there. And I would say my personal journey, it was about 2 years of finding the joy. So 2 years of like inconsistently or not working out, and then